health and government officials are warning about a spike in COVID-19 cases in South Africa and the possible reintroduction of strict lockdown restrictions. Last week, KwaZulu-Natal Premier Sihle Zikalala said a return to a hard lockdown could be on the cards unless the country experiences a decline in the number of daily coronavirus cases. So, how close are we to all of this happening? To discuss this, I'm joined by Dr. Angelique Coetzee from the South African Medical Association. Doctor, good evening to you and welcome. So, we have seen an increase in cases in parts, and let me stress, in parts of South Africa. In your opinion, is there then a strong enough case for a stricter lockdown?
Jeremy, good evening, and a good evening to all the viewers out there. No, there is not a very strong case currently. I think just let us refresh our minds again to understand how we look at this. So if our transmission rate is less than 5 cases per 100,000 population, then it means we are doing pretty well. So to look at what is happening, only yesterday in South Africa, we were at 2.7 cases per 100,000 population. And if we look at Belgium yesterday, they were at 169 cases per 100,000 people. Now, that is seriously. So that will overwhelm our healthcare system. If we look again, coming back to South Africa, and if we look at our in the last 2 months, we average between 2 to 3 cases per 100,000 population per day, which is with an average of about 1,570 cases per day, which is quite, fairly stable looking at what is happening. And yes, you are absolutely correct. There is a bit of a surge in 2 provinces especially. The one is the Western Cape and in the Eastern Cape, where we saw in the last 2 to 3 weeks a very slight increase in their numbers. Also, don't forget that the Free State and Northern Cape is still in the first wave. They haven't been out of the woods there yet. So if you then look at the numbers, you will see that the rest of our provinces, the transmission rate is quite low. So there's still no reason for any panic to develop and to start, using the word lockdown in a very stricter sense.
Dr. Coetzee, we are heading into the height of summer. Hopefully the holiday season will see more and more people outdoors. The other issue, of course, is we're just bone tired of being in lockdown for 8 months. Part of the problem, surely, or part of the concern, would be to continue convincing people to adhere to those basic regulations. And there is ample evidence of people not doing that.
You are so right. People have become much more complacent. They're not following the rules. It seems to us that, the less the restrictions, the less that people restrict themselves. So it is extremely important for the average person out there to understand, by wearing my mask, by doing the social distancing, it shows that I care for you. And therefore, I try to protect you. If we can get that message back to our people, please, it is a responsibility you need to take. If we can do that, and with a bit of a tweak in restrictions, hopefully we will never have to go back to that terrible lockdown stages that we were in.
Dr. Coetzee, you're citing the science, you're citing the data. You're saying that at this point there is no need to start talking about a second lockdown, yet we have politicians, for instance, the KwaZulu-Natal Premier, who says, and I quote, a return to a hard lockdown could be on the cards. Is that irresponsible, do you think?
Well, normally, if we look at the politicians, sometimes they don't understand the data like as in the healthcare, or we also are being guided by scientists in the healthcare understanding this. So it is a bit irresponsible to say, you know, I am going to put you in a stricter lockdown situation if you do not listen to me. Because again, remember, the virus is not interested. He doesn't care whether you are in a lockdown or not. The most important thing is to maybe look at a bit, to tweak our restrictions. To go and look at mass gatherings, because that is where our super spreaders normally start. Mass gatherings like in your bars, your sport places and churches, those type of things, funerals, maybe just look at that again. But we can bring in as much lockdowns than we want to, if people do not do their part, if people do not start to take responsibility. It's not going to help us.
Dr. Angelique Coetzee, thank you very much indeed from the South African Medical Association. I want to take you